Today, on behalf of All India Council Human Rights, Liberties and Social Justice, National Council for News and Broadcasting, Safeguarding Children Seva Samiti Uttar Pradesh, Koshambi Foundation Uttar Pradesh, International Human Rights Commission, and Voices on the Mount Africa Ghana, under hashtag Innovative India Movement, we welcome our guest speaker, Mr. Khushroo Pastakia, CEO and Managing Director, Voxter Bio Limited, Gujarat. He is Master of Commerce, Master in Business Administration, Gold Medal, Master in Management Information System, Chartered Accountant, FCA and CPA. We welcome you, sir.
Good evening, everyone on the digital platform. As Kaushik has already given a brief introduction about myself, I've been into IVD industry since last 22 years, and since last 7 years, I'm working with Voxter Bio Limited as a CEO and Managing Director. Basically, Voxter Bio Limited is a 7-year-old company. It's a good manufacturing. It's having a good manufacturing setup with 40,000 square feet of infrastructure and accreditations from Indian FDA and ISO 13485 from BSI UK. We have a presence across pan-India as well as in 45 countries across the globe. And we manufacture IVD testing kits in rapid testing platforms, ELISA test kits, agglutination, SIRAs, flocculation tests, and also a couple of plastic laboratory consumables we do manufacture. And recently we'll be coming up with our own range of microbiology tests, and also on the clinical chemistry front. Of course, infrastructure and everything has been in place, and we'll be coming up with its commercial launch very soon.
Very nice.
Today we'll be talking on IVD as a career. So first we need to understand what is in vitro diagnostics. Now, as far as in vitro diagnostics is concerned, in vitro means the one which doesn't go inside your body. The other counterpart is in vivo. So where something is pierced inside your body to check what is wrong with you, and that's how the testing is done. And that's how it is called in vivo. Whereas in vitro diagnostics, nothing is done inside your body, only your blood sample, urine sample, saliva sample is taken to test what is the profile, what disease a person is suffering from. Earlier, if we remember, say last decade or say 15-20 years back, the experienced general practitioners would give a rough idea on basis of the patient's symptoms, how he explains what is happening, and accordingly he used to give the medication. So it was all pre-judgmental, it was not diagnosis. But let me tell you, diagnosis is a prima facie first step before imparting any medical treatment. So those days are now gone. People are highly conscious nowadays. They are very much health conscious. And that era of pre-judgment is now over. So more than 80% of the medical treatments worldwide now is done through in vitro diagnostic tests, and that is done in a clinical laboratory. So when your doctor says that, okay, you need to go to a lab and do the test, that could be based on to check your blood group, that could be to check your chemistry profiles like cholesterol, triglycerides, that could be to find out some infectious disease a person may be suffering from, or even a vector-borne disease like malaria, filaria, or whatever. So diagnostic comes before treatment, and it is very much important to diagnose first, so that right medication can be given to the patient at the right time. Because if wrong medications are kept on given to the patient, the body creates an immunity whereby when that real thing happens, that real disease comes in, that effectivity of medication is gone. So to ensure that a person doesn't get immune to certain type of medication without any reason, diagnosis is very important.
So sir, do we have any do we have any kit, IVD kit and something like that, which can be used by the person beforehand?
Yes, there are a couple of testing kits like a pregnancy test, LH ovulation test, which are OTC tests which are sold across chemists, and that can be a person can do it at home itself. But even blood glucose testing can be done at home through those glucose monitoring. But in India, the Indian government doesn't permit to carry out the laboratory test at home. So you need to definitely go to a clinical laboratory to carry out any test. Unlike in other countries, developed world like UK, even an HIV test can be done at home. But in India, that is a mandate, because there is a reason behind it. The government feels that a wrong testing, a wrong result may lead that person to some suicidal attempts or something, wrong actions. So that's why it's always preferred to go to a laboratory where a professional is handling your blood or your urine sample to give you the right results. So that is where there are home tests, but still clinical laboratories are more preferred.
So, sir, what is the difference between medical device and IVD? Can you explain that?
Medical device, IVD is a part of medical device. And medical device is a very large platform. Even a stent comes into a medical device. Whereas IVD is specifically only for testing, nothing else, only testing. So, for example, the recent COVID infection, we see IVD coming into the front seat from the back seat, where the diagnosis becomes very, very essential to give the right treatment. So IVD means in vitro diagnostic testing, whereas medical device is a very wide concept where everything, even surgicals, everything gets included inside the medical device concept. So it's a broader term. IVD is part of MDR, medical devices, medical device regulation 2017.
Okay. So how can we make or career in IVD? Like if the students of now generation, they want to, right? Yeah.
See, in IVD, there are, as per my observation, there are 5 ways to venture into IVD platform. Either you can become a test kit manufacturer, which is a big exercise, big protocol, requiring investments maybe in couple of crores, maybe 15-20 crores to start with. You need to have a 10,000 class, 10,000 facilities class, 100,000 facilities, all the accreditations, FDA license, there is a Food and Drug Authority license, lot of protocols to be followed. So one option is to start a manufacturing company for the in vitro diagnostic testing kits. Of course, the current central government drive on Make in India or Atmanirbhar Bharat is definitely the right time to venture into if you have enough number of investors or enough funds to embark upon. Then second option can be to become a test kit trader. So one can become an IVD test kit trader, whereby he can procure from couple of companies across pan India or from abroad, and then he can sell those products to the clinical laboratories. There is a normal trading business on either on exclusive terms or non-exclusive terms, and he need to finalize which products he want to sell and which area he wants to target. The third option could be to open up your own laboratory. In that case, you need to be, first of all, you need to have a pathologist to sign the test report. In India, even a DMLT or a MSc Micro or BSc person can open a lab, only subject to that the reports are signed by the pathologist. Ideally, a permanent pathologist is required to run a lab, but still there are exceptions, and just because the NABL accreditations is still very much limited in India, these type of activities are still followed. The other option is to work in a laboratory as a laboratory technician. So there again, you need to have a science background, BSc, MSc, biotechnology, or you can be DMLT or BMLT, that is Diploma in Medical Laboratory Technology. And the last option, which I feel is to join a company, IVD company, as in various functions, either as a product manager or as a research scientist, or into quality control and assurance, or into production, or into research and development. So these are broadly the 5 areas which I see as a potential for any person to venture into IVD as a career.
Very nicely explained, sir. Very nicely explained. So there is one question, like, what is FDA approval, and do we require it in India?
See, FDA means Food and Drug Authority. So every country has an FDA. Even India has an FDA. Okay. But it is a misnomer used in India against US FDA. So if you are going to sell your product in United States of America, you need a US FDA. Without US FDA approval, you cannot sell it. But in India, you don't need a US FDA. Even almost in most of part of the world, you don't need a US FDA to sell your product. Only when you sell your product in a regulated market like European Union, America, Canada, Australia, Japan, there you need to either have a CE mark, that is the registration from the European Union, that is CE, or you need to have US FDA. In India, there is no requirement for US FDA, and there are a couple of government guidelines, circulars, specifically drafted to show to those persons if they ask for FDA approval from US.
Okay. Okay. So why it is so important to invest in testing nowadays?
As I explained earlier, that the diagnoses were based on the prejudgmental things from experienced doctors, just based on the past exposures and experiences they used to give and on a haphazard basis. But correct diagnosis has become very, very important. And that is one of the major reasons that the age of human beings have increased because of this, because of the right testing done on right time. So that precautionary actions, precautionary medications are taken. And that is one of the major reasons where even all the major healthcare organizations across pan-India insist on pre-medical checkup before venturing to any deployments, which are venturing to employments or any other actions where they need to deploy some person for their staffing. So testing is very, very important, because without testing you cannot define the medication.
Right, exactly. So do you, sir, nowadays like people are suffering from cancer and so many other problems. So what advice do you give to them? Like what precaution they can take by using the IVD?
See, again, there is no question of precautions by using IVD, because IVD will only guide you whether you're suffering from that cancer or not. Ultimately, medications are a different segment. It is a different protocol. It is a different sector. Whereas IVD will only tell you that, okay, that person is suffering from this specific form of cancer in this specific area, and that needs to be addressed. So it is only a highlighting point. It acts as a highlighting point that, okay, this is some problem over here and you need to take care of over here.
Okay. And so what is IVD manufacturing?
IVD testing
like in
manufacturing.
Simple language.
Yeah, in IVD testing manufacturing, the IVD itself is classified into several areas. Like one is biochemistry. So if we talk of the global market share, like 25 to 35% market share is biochemistry. In this biochemistry, it includes all your chemistry profiles like glucose, cholesterol, triglyceride, creatinine, phosphorus, and all the chemistry profile. The next one is immunology, where you check the infectious disease segment. There's HIV, HCV, malaria, syphilis, all the immunology products, which again takes it covers almost 30% of the market share across the world. The next segment that comes is hematology. So that takes care of cell counts, WBC, RBC, that is white blood cell, red blood cell, hemoglobin, vitamin B12. So that again is a separate segment to diagnose. Then there is microbiology, which covers the pre-port culture media, the stains and indicators, antibiotic sensitive discs, and blood culturing systems. And lastly, but not least, is the molecular biology, which nowadays got a very, very prominent importance because of the PCR test kits. So COVID-19 brought molecular biology in a very much limelight. It was only found in the developed world because it's very expensive. But of course, the results are very, very good in molecular biology. But then because it's very expensive, it is not meant for the developing world or underdeveloped countries. So India, maybe we can classify it as a developing world. So now molecular biology will be the hardcore successful segment to embark upon. And if we look on the COVID-19 profile as on date, only PCR is considered as a gold standard to know whether the person is suffering from COVID-19 or not. So these are broadly, of course, there are other segments also like histopathology, cytopathology, coagulation and all. So there are a couple of profiles, there are a couple of segments where this IVD is classified into. And one can venture into manufacturing of these test kits for all these profiles. And that could be in the form of ELISA test kits, that is enzyme-linked immunoassay. It can be in the form of liquid reagents. It can be in the form of dry reagents. It can be form of rapid testing kits. It can be form of chemiluminescence assay, that is CLIA. even fluoroluminescence assay, that is PIA. There can be aggregation test, flocculation test, and of course PCR, that is polymerized chain reaction. So there are a lot of testing platforms, and you can venture into, depending on what segment you want to target at, which is the more each market has its own importance, its own spread out, and there are almost like around, as on date, 50 plus manufacturing companies across pan India. So the number of players are not that very high, and still there is a wide scope of venturing into manufacturing of the IVD testing kits. And these are the basic broad classification where one can find out which one would be more better to venture into. Of course, as I said, molecular biology, though it's very high-tech technology, high-tech platform, but it is more prominent and more promising in coming years to come.
Exactly. So one thing I want to know, like you are being majored with so many master's degrees, and even you are a chartered accountant. So what makes you, impact, more of aware about all these things? How you come to this field? What was your life journey? We would love to know that. Please tell us about that.
Of course, I am a chartered accountant and I have a finance background. I did started my profile as a finance manager only, but the level of exploration to understand different things in life. Like if you see my profile, I have not just been associated with IVD. I have also been associated with manufacturing of the equipments for the within inspection systems. I have been also associated with the plastic segment. I have been also associated with the stent manufacturing systems. So I have been also associated with the laser technologies. So I like to explore upon more and more things, but fortunately or unfortunately, whatever you may call, IVD was more coming up in my profile naturally, and that's why I studied a lot in IVD also. Though I'm a chartered accountant, I still have in-depth knowledge of each and every technologies, and that's how I venture into. I like exploring new things and taking up new challenges. That is my way of doing things. That's the way I have even traveled across the world. I have I form joint ventures abroad. I have formed new companies abroad. I have worked in foreign companies also. So it's a wide portfolio that I have been handling. But IVD had been on the core front. But still, I am open to so many other venues also. Even I can talk on Ayurveda. I can talk on these laser technologies. I can talk on the
that's great. Anything. That's great. So we will definitely have you for all these career sessions, sir, because I believe you are full of knowledge and we require it, or NGO kids require it, or students require it today world. And so one more thing, what advice do you want to give to today's generation students? If they are into one field, how can they opt for the other? How if they are willing to do something else? So how can they make their interest to come into force?
As I said earlier, you can take my own example. I'm from a different background, but I work in a different field altogether. Though I have been also into commercial fronts, I've been also into marketing, I've been also into finance and everything. But I would always suggest that whatever you like the most, you should explore on that aspect and you should give your best in that area only. Try to become more of a master in one specific subject where you can portray yourself as the best, and that would be the game changer for you. If just because of studies you study, that is fine, but ultimately what you study is something completely different from what you actually practically implement in your real life, in your corporate world, in your job, or anywhere. So education is something different, and your liking is very, very important when you select your career. So whatever you like the most, you should definitely embark upon that. I'm more in I like more on the creative front. So I've been very strong in marketing. I've been very strong in portraying, launching new products, new companies, new projects. So as far as whatever is your liking, you should always focus on that area.
Very nicely explained, sir. Thank you so much. And sir, one last question we would love to know that, if the students, if the coming generation, if the any parents or children, they want to contact you for further discussion on IVD projects, on IVD manufacturing or anything, because you are full of knowledge and you have so much of, explore so many sections of and disciplines. So how can they contact you, where you can be found easily, and how can they get
Well,
mentoring session with
if
you?
you type on Google Khushroo Pastakia, you will have n number of pages, and there all the informations are there. Even my phone is public, so anybody can call me anytime for any information. They are always invited. As long as somebody is building up their career, it is ultimately a good deed that will be going credit to me only. So that is fine. They're always invited upon.
Thank you so much, sir. Thank you so much. And we are very pleased to have you today. And thank you for taking out your time, precious time for us for the discussion. And All India Council Human Rights, Liberties and Social Justice and National Council News and Broadcasting. Thank you from all of us, all the NGOs. And thank you for joining us today.
It's all the pleasure. Thank you very much. I enjoyed the show. Thank you. See you then. Bye-bye.
Thank you, sir.
Yeah,
Bye-bye.
bye-bye.